There's three items that you didn't give the attention, that's why we call this special meeting. There's three items on your agenda that require immediate attention, that's why we call it a special meeting.
Good evening. I call this special meeting to order and ask that you rise for a moment of silence and a pledge of allegiance. I pledge allegiance to the flag of the United States of America, to the republic which stands one nation, under God, with liberty and justice for all. Alexis, would you please call the roll?
Mrs. Reed,
Here.
Mrs. O'Connor,
Here.
Mrs. Ruha,
Here.
Mrs. Snell,
Here.
Miss Doobie,
Here.
Mr. Von,
Here.
and Mayor Sapelli.
Here.
Present, to form.
Thank you very much, Alexis. We have three items that need immediate attention. That's why we have this special meeting called this evening. Next, under business, our first item is for remote learners. With us this evening, we also have our athletic director, Mr. David Stratton, to assist us with any questions, concerns you may have relating to this particular issue. Now, the MIAA decided, along with DESE, that sports would start on September 18th, fall sports. And I am going to ask that we have a motion and a second, and that we take a vote on having fall sports this year for the Agawam Public Schools. Is there a motion?
So moved.
Second.
Motion made by Mrs. Ruha, Ms. Doobie, and seconded by Mr. Minio. Questions or discussions?
Yes, Carrie O'Connor. Sorry, go ahead.
No, go ahead, Carrie. Go ahead.
Yep, I just have a question on, maybe David could answer these questions about what what this would look like for safety precautions with our student population. Fall sports.
Currently, first of all, good evening and thanks for having me. I appreciate being part of this, so thank you. First and foremost, the MIAA has been working pretty much all summer. There's a COVID-19 task force that was charged by the MIAA Board of Directors to come up with a plan through using EEA guidelines to facilitate safe participation of sports. So basically what has gone on very recently is the individual, once this document that was put together by DESE and MIAA was posted, the COVID-19 task force turned it over. They're not done, but they turned it over to the individual sport committees. For those of you that don't know, the sport committees are in charge of that particular sport throughout the state. So we have representation from District 1, which is where we are in Agawam, Western Mass, including the Berkshires is considered District 1. We have representation on all these sport committees. The short story is the sport committees made guideline changes to the sports, kind of made up new guidelines to fit in and adhere to the EEA guidelines for that particular sport. So, for example, if a sport is a low risk sport, that particular committee made the adjustments to make sure that student athletes could safely participate. Same thing for a moderate sport. Right now, the high risk sports have been pushed off. So that's what's currently happening now. The sport committees come up with guidelines. They're very recently have been given to the Sports Medicine Committee, of which I'm a member. And we've been meeting all week trying to get these these guidelines kind of through us. We've had Dr. Nelson, who was helping out with DESE. She was very helpful to us, but it's sports medicine is basically athletic trainers, physicians. There's a few dentists on there, some strength and conditioning people, but there's also ADs. So we've kind of gone through it. We've just recently finished volleyball a few hours before this meeting. All of those are going back to the COVID-19 task force and then to the board of directors. And those guidelines will be released September 1st. So currently those guidelines aren't public. They're not out there for people to kind of take a look at. Not only us as leaders, but the coaches and kids don't know what they're up against yet either. So those guidelines have passed through many different kind of channels to make sure that we're taking care of the kids and their safety.
Thank you, Mr. Stratton.
Dave, can I ask you?
Hold on,
I was just gonna
Mr.
say,
Bonavita, hold on one second.
I think it's important to note that the high impact sports that are typically in the fall are not being recommended to be, have competition against at this point. Is that correct, Dave?
That's correct. The three sports that have been basically pushed to there's 4 seasons now instead of 3 high school seasons. They basically have like what we would call a fall 2 is what it's been named a little bit. It could be a flex season, perhaps. Football has been moved there. Unified basketball has been moved there because basketball is a high-risk sport, and unified would definitely qualify as that. And cheerleading has been moved to the fall 2 as well because of the nature of that activity as well.
David, start date for fall
I'm sorry, Mr. Mayor?
2? Start date for fall 2?
The start dates are sort of loose, to be honest with you. There was some talk of that fall 2 starting February 22nd, and some of those dates were have been in. They've gone back and forth between early March and now they've been set at February 22nd, which, obviously as an athletic director, I have some feelings about starting an outdoor sport in the last, the late February. But, if that's what's going to happen, we'll make it work. So right now, February 22nd is the date for that fall 2 season.
Thank you. Mr. Bonavita.
That's what I was going to ask is, I was going to ask them just to quickly go over the sports that have been pushed off so the public has knowledge of it. And we also have it clarified. I mean, so what, I guess the question is, what are the sports that are going to happen this fall, starting when school starts?
Starting September 18th, we would be offering boys and girls soccer. We'd be offering gymnastics, and it's girls gymnastics, but we allow boys to participate, but it's girls apparatus. So we have male gymnasts who participate, but it's female apparatus. Boys and girls cross country, field hockey, girls volleyball, and golf. Those would be our fall sports, and we would lose those other 2 sports, and of course the club sport of cheerleading. Those would be pushed to fall 2.
Okay, fall 2, and then the other ones in spring.
Winter sports are scheduled to start November 30th. So
that's like
basketball, hockey, wrestling. Winter gymnastics we don't offer, but MIAA has that in there. Indoor track, alpine skiing, which is our downhill skiing. The winter cheerleading season would be considered in there. Cheer and dance, and then of course swimming and diving, which we offer in the winter. In the eastern part of the state, swimming and diving is a fall sport. So those guidelines have already been gone through. We sat through that with sports medicine. The swimming and diving committee has already come up with some guidance. Guidance will evolve depending on where we fall and how things are going.
So I understand that. So now this fall 2, they would start on the 22nd of February, and
Yes.
They would be going on probably at the same time as
No, all of these are actually,
the other ones would be finished.
they're actually separate seasons. Yes.
Okay.
I'll go through these again after we're done talking to them, so you're sure of the dates. But that
Yeah.
fall 2 is supposed to be over April 25th.
Okay.
And then that's when our traditional spring sports would start, the 26th. We would start the very next day. And the MIAA has us finishing on July 3rd.
Okay.
So the date.
So obviously, I'm sorry.
No, go right ahead. I'm sorry.
No, I was just going to say the November 2nd ones are the ones that I would suspect have the most stringent guidelines, since they're right in the heart of the winter.
Well, right now, the only sports with guidelines are the ones that we're playing this fall. We literally, the MIAA and its individual committees hammered out these guidelines in short order. It was done in about a week, and then it went in front of sports medicine, and we've been meeting all week trying to get that done, and then it goes to board of directors. So what's going to happen is we're going to begin working on winter as soon as we get into the fall. Then we're going to start working in those winter committees. They're already meeting, I'm sure. I'm the liaison to District 1 for softball, so I'll be involved in that relatively soon, because that'll come around before we know it as well. But yeah, so instead of having our traditional 3 seasons, we have 4. So they are a little bit shorter. They're a little bit shorter, but we do go a little bit longer, obviously, because we're going into July.
I understand. Well, thank you.
Nope, that's perfect.
Okay.
Mr. Stratton, I have a question.
Mrs. Rua.
Really quickly, can you just help? It's low and moderate risk are those are the only 2 categories allowed in fall 1 and fall 2, or no?
Well, according to the EEA document, which I'm assuming everybody's familiar with, I'm not trying to be funny. It's just it changes all the time, and I think the most recent one came out on the 17th, and right now we're still in that step 3, phase 1. Mr. Mayor, is that what we're calling it? I'm pretty sure that's what it's called.
Yeah, correct.
So we're still in that. So we're still up against the same restrictions that we've been up against most of the summer, since these were put out in July. So we're currently only looking at those. We can only practice fully and compete with modifications with those low and moderate activities. Correct.
Okay, thank you.
Any other questions, comments, concerns? Okay, we have a motion and a second. Now we're ready for a vote. Alexis, would you please call the roll to have Agawam Public Schools accept having fall sports starting September 18th?
Mrs. Reed,
Yes.
Mrs. O'Connor,
Yes.
Mrs. Rua,
Yes.
Mr. Minio,
Yes.
Ms. Stube,
Yes.
Mr. Bonavita,
Yes.
and Mayor Sapelli.
Yes.
7 yes, it's unanimous.
Thank you. The second part of this vote, which we want to talk about, discuss, is remote learners versus hybrid learners. The state made a distinction between those that are going remote and whether they should be allowed, and they suggested school committees have a vote on whether to have those that are choosing to stay home and use remote, if that group is allowed to play athletics and participate in athletic or any extracurricular activities, band, chorus, whatever, or just those that decide to show up for FaceTime in the hybrid model. So what I would need is a motion and a second so we can have some discussion on that particular subject. So is there a motion?
So moved.
Second.
Second. Well, the motion, I assume, is to allow remote learners
Correct. To
to
allow
participate in sports?
participate in extracurricular activities, Mr. Bonavity. Yes.
Okay, thank you. I'll
Thank
second it if somebody
Okay.
else hasn't.
Back, please, and by name, who was the one that made the motion, please?
Dawn did.
Don, thank you. Seconded by, I know Mr.
Me.
Bonavity and Mrs. Rua.
Mhm.
Carrie O'Connor.
Gary O'Connor as well. Questions, discussions?
So,
I have a discussion.
Okay, one at a time. Mr. Bonavita, go ahead.
Well, I've been thinking about this, frankly, for the entire day. And I think this is a question that really should be left up to the parents and the student, concerning whether or not they want to participate in sports if they're learning remote. So I'd be in favor of remote learners being able to participate in sports. I frankly think that question should be left up to the parents.
Thank you. Mrs. Doobie, I know you had a question, concern, comment.
well, I've been really kind of struggling with this one because, you know me, I'm a huge proponent for kids going back to school full time. With that said, if they were back to school full time, we wouldn't be having this conversation or this decision to have to make. I agree with Mr. Bonavita that parents, should have that decision. But I do struggle if you're not able, for one reason or another, to be able to come to school to do some learning, in-person learning, then I do struggle with being able to play sports or doing any kind of extracurricular activities. However, I am a sports person. My kids played 3-season sports all through high school and all through youth. I'm not against sports or extracurricular activities at all. So I'm really having a hard time with this. So I'd really like to be able to have a discussion and hear what other people have to say before voting. So thank you.
Mrs. Rua.
I've also thought about this a lot. I've actually tried to ask around to some parents who have chosen remote what their thought process would be if they were to send their child to play sports. And the ones who answered affirmatively spoke about the fact that golf, for instance, is pretty individual. It's a very individual sport. In the winter, skiing, the same thing. Gymnastics, cross country, some of these are sports that would be an exceptional release for social emotional, for the well-being of the student who's been at the computer all day doing remote learning. So they talked about the feeling very safe with choosing certain sports. Now, that said, I don't think they would choose wrestling necessarily, because that would probably feel kind of contradictory, is what I heard some of them say to me. But would they like the option for maybe golf or skiing or running track, doing cross country? They think that option. And Mr. Stratton, when you just said marching band would fall into that category, I think we need to remember marching band is going to be completely virtual. So to take away that opportunity from a remote wouldn't even make sense, because that is virtual marching band for the remote students and the hybrid students. So I think we want to be really careful with that. The other clubs that are going to be virtual, with the marching band that's going to be virtual, to not lump all of that together and think of it all as one size fits all. Does that make sense? So I would be in favor, like Mr. Bonavita, of letting the parents choose, because there are some sports that really might fit for their student, for their learner, for their kiddo, and be an excellent release to what is certainly going to be a lot of time on the screens.
Hello, Carrie?
Yes, go ahead, Mr. O'Connor.
Yes, maybe this is a question while we have Mr. Stratton. Is he still on the line?
He is on the line. Go ahead.
I'm here.
Yes. Has your department thought about this option for remote learners? We do talk about the high-risk category is not right now going to be happening. However, field hockey, you did say that because we are still on phase 1 of level 3 with the mandatory, the 6-foot distance. You're saying that the MIA is making exceptions for that. So that's the first question. The second question for the remote learners as well is, there are sports. Has the district thought about any other sports to actually adhere by those 6-foot guidelines?
Well, I think that to answer your first question, all of the athletics are being guided by EEA document. That's what the COVID-19 task force had been using and the sports medicine committee had been using to formulate guidelines for athletics. The individual, like I said earlier, the individual committees that are sort of experts in their particular sport. It tends to have some coaches that understand the game and officials and so on. So what they've tried to do is make whatever changes necessary to be able to satisfy the guidelines that are in the EEA document. So the EEA document is the guiding principle, I guess. It is
Okay.
where the buck stops on that document. And we have to make sure that we being MIAA, the MIAA member schools and the committees, and we have to adhere to those guidelines when we're making our sports guidelines for the individual programs and activities. And also the PDIAC, our conference, has also been meeting all summer, and there's going to be changes to schedules and things like that as well. So we're looking to, change things a little bit when it comes to travel and whatnot. We're looking to stay a little bit closer to home, and it's not all about competition, really, to be honest with you. We all just want to get out there and play. It's almost like what sports are supposed to be about. So actually, most of the ADs are excited about the pureness of it all. So we're kind of looking
Right. Yeah, this is a very difficult, there's a significant portion of our remote learners, I would say close to about 30% of our population of students that are, if they are remote, then, definitely, we don't know what the circumstances are, if they live with someone who would compromise immune systems, and it's just safety comes first. So, those are all the questions that I have.
Thank you very much.
Thanks.
Other questions?
I don't, Bill.
Mr. Antonio, go ahead.
So I don't really have any questions. Just going to sort of voice my opinion on it. I think Wendy covered a lot of stuff that I'm going to say, but I think it's going to be the parents' judgment on whether they feel safe, having their children playing the sports. I can't imagine a scenario where if they were, they decided for the child to be remote, that they would have them play a moderate risk sport. I'd say, as you said, it's going to be more of the low risk sports, individual sports that they'll have them play. So I think it's leave it up to the parents, cover fall sports and then sort of see where we are, as November 30th approaches for the next season. So that's it. Thanks.
Mrs. Reed.
I agree with Mr. Minio. There's a lot of sides to this. I mean, if you just look at it and say, well, if your child's remote, how can you let them play sports? But there are sports, as Mrs. Ruiz said, that are very low risk, as in golf and skiing. So I would be in favor in allowing the kids to play, the remote kids to play sports.
Thank you. Any other comments, questions, concerns?
I was just,
Go ahead, Mr. Bonavita.
I didn't know. To me, when I thought about it just recently, made up my mind later this afternoon. The way I looked at it was, do we want to penalize the remote kids from playing sports just because they choose remote? And that's my answer is no. And it is true, they may pick, it'd be interesting to see, Mr. Stratton, what the numbers are, actually, which sports attract what numbers. That's going to be interesting to see because of some of these sports being really different from each other as far as closeness and contact. But I'm in favor of the remote choosing. Let their parents choose them, or if they want to choose for their sons or daughters, that's up to the parents.
Yeah, Carrie, I also agree. That it should be up to the parents' decision.
Thank you. I know, Mrs. Hoffman, I think you had something.
I just have one piece of information for you. You may already know this, but if you don't, we also allow children who are homeschooled to participate in sports. So that might help you.
Yes.
I have one more question, if you don't mind.
No. Mrs. Ruah.
Are we following, I would assume, and Mr. Stratton, you can please weigh in on this same notification protocols if there's someone that tested positive for COVID, the whole team would know, like, we're following certain set protocols and guidelines that will come out regarding mask wearing, notification of illness, things like that, sanitizing, all of that's going to come through the guidelines, yes?
Correct. The presently the MIAA, the committee that I'm on, sports medicine, is completing a document that basically is going in the front of all the, it's like a common verbiage going into each sports guidelines. So all the information is the same: masks, use of locker rooms, the social distancing, so on and so forth. Just for your own edification, I mean, these sports are going to look a lot different than they looked last year. And I can tell you this much. I mean, masks are going to be the order of the day, not just in school, but also in athletics. So, yeah. And there, of course, we need to adhere, to, our health department's guidelines, the things that are passed through our own town government through Mayor Sapelli and the health department and so on. And of course, the school department and Mrs. Hoffman are going to give me, the additional guidelines too, that the principals and all the other directors, need to follow. So we'll be using those same protocols. We'll be using the same type of someone has symptoms, we're isolating in a particular place with a person who can identify those kind of symptoms and stay with that person, get them to the parents and so on. So we're following the same procedures that have been put in place by the district, but also that's a pretty common thread all the way through not only the guidelines that you get from the state government, but also the state association, the MIAA.
Thank you. That makes me feel even better. I appreciate that.
Thank you, Mr. Stratton. Thank you for your input, Mr. Stratton. It was very helpful to have you on this call this evening. Thank you very much.
It's my pleasure.
For all you do, your job, like everyone else's these days, is grown exponentially in many areas you never thought you'd be in. So thank you very much. Greatly appreciate it. I personally feel that one of the main things we have to do is to have students return to schools as much as possible. What we do, and the reason we have extracurricular activities and school, is socialization. So if we can get these students back with activities, socializing, that's part of their educational process and curriculum. So I think that's a good thing. With that, Alexis, would you please call the roll? Yeah, yes vote is to allow the hybrid model, all students, both remote and those in person, to compete in extracurricular activities at theirs and their parents' wishes.
Mrs. Reed,
Yes.
Mrs. O'Connor,
Yes.
Mrs. Ruah,
Yes.
Mr. Minio,
Yes.
Ms. Doobie,
Yes.
Mr. Bonavita,
Yes.
and Mayor Sapelli.
Yes.
7 yes, it's unanimous.
Thank you. Next, we have our second item, which is a Family First Coronavirus Response Act. Those of you that are familiar with this act, it states basically it started with a 2-week period. Now they're adding 10 weeks, so it's a total of 12 weeks where there can be intermittent child care leave for employees of the school system. This has been an issue I know that's been discussed in some of the impact bargaining. I want to clarify what is happening and what the law states presently. And what the law presently states is that with the combination of the 2 and the 10, it's up to 10 weeks of leave. And this is for caring for his or her child whose school or place of care is closed or child care provider is unavailable due to COVID-19 related reasons. If this is the case, this act calls for that individual to receive 2/3 of their salary with a maximum of $200 a day. So it's capped at $200 a day, and they would receive 2/3 of their salary. Now, the item that's coming up this evening is, do we want to allow staff members to use their accumulated sick time for that other third. And the formula for that would be the same as it is for the Act. In the Act, it calls for 2/3 of their pay at a maximum of $200. You do the math calculation on that, obviously it would be $100 per third. So for that third, the same theory would be in effect. It would be capped at $100 at that point for that additional third if the school committee chooses to add an additional third of their salary. So this would vary for individuals when we do the calculation of their daily rate. If a teacher's at top step at 80,000, their daily rate may be 400 and something dollars a day. If somebody's on the front end of teaching and is making 45,000, obviously their daily rate would be less, be somewhere around 275. So it'll fluctuate with that cap, obviously. So somebody at the lower end of the salary rate may end up getting with the 2/3, and if we vote to give them the additional 1/3 through their accumulated sick time, if they have it, they have to have accumulated sick time, then they may be whole, if you will, be able to make that salary if they're at the beginning end of the steps. If they're at the higher end of the steps because of that cap, they won't necessarily get that full salary, but they will get that $100 for each third, or a total of $300 a day as a maximum. I just want to clarify that for everybody. So at this time, is there a motion to allow staff members to use accumulated sick time for the other 1/3 of their salary that the Act does not cover? Is there a motion and a second, please? And if you would give your name, I can't always tell whose voice that is.
So moved, Carm.
Mr. Minio made the motion,
Second by Dawn.
seconded by Ms. Doobie.
Yep.
Questions, discussions, comments, concerns?
No, I have a question.
Mr. Bonavita.
I understand of the salary part of it. The beginning of it, you read the Act, and I assume that's still in place. This applies to only if for COVID-19 they cannot get adequate childcare. Is that, am I correct, or I misread that?
Yeah. Now, I will read it again. Qualifying reasons for leave related to COVID-19. One of the issues that we're dealing with, there are several, but we're dealing with using accumulated sick time for family leave because of childcare issues. It says, is caring, if this individual is caring for his or her child whose school or place of care is closed, or child care provider is unavailable due to COVID-19 related reasons.
I understand. Okay.
Okay?
That's what I thought. That's what I thought it said. I just wanted to make sure. Thank you.
You're welcome. Other questions, comments, concerns?
I have a question.
Rua.
Mrs. Hoffman, you might not be able to speak to this yet because it might be in negotiations. I'm not sure. I'm not on that subcommittee. But I saw the DESE new regs about that children can go to school if they are the child of a teacher. Can you talk more about, are we doing that in this district, and would that maybe reduce the number of people that what we're voting on right now would affect? Can you kind of speak to that a little bit?
I can. We're still trying to look at what those numbers would look like for data. We had a admin meeting today where, principals are getting pretty settled with the cohorts and how many kids they can fit in a room at the 6-foot distance. And so we're a little worried if we are allowing teachers' kids to go a priority, that would significantly skew that a little bit, and we would have to make additional sets of cohorts and rearrange homerooms. And so at this point, we're not thinking that would be a possibility because of the date, the timeliness of it, and the fact that we have, many groups in the hybrid model that are kind of at 10 to 12 in person. And so adding to that would increase our numbers and put us at that 6-foot distancing, kind of making us having to move around more cohorts, more teachers, more students.
Okay, so that's not an item of negotiation. That is just a no. We're not doing that in Agawam.
At this point, we don't think we can fulfill that request.
Okay, that would be all the more reason for me to vote affirmatively on this.
Questions, comments? From others? Seeing none. Alexis, would you call the roll? A yes vote is that you are in favor of allowing teachers that have accumulated sick leave, they have to have it, obviously, that we will allow them to use it with that formula I spoke to of a cap of $100 per day for that third, added to the other 2/3 that they're going to be allowed to have through the act itself. The yes vote is that you are agreeing to allow them to use that. And I need to say that this was not part of the impact bargaining. This is just something that came up that we thought was probably a good thing to bring up for them, because as we all know, many of the individuals related to the school systems, whether it's the teachers, the paras, the nurses, the administrators, are going through, as the school committee is, some challenging times with all the issues coming up with this, and it's the right thing to do, in my opinion. So, Alexis, call the roll, please.
Mrs. Reed,
Yes.
Mrs. O'Connor,
Yes.
Mrs. Rua,
Yes.
Mr. Minio,
Yes.
Ms. Doobie,
Yes.
Mr. Bonavita,
Yes.
and Mayor Sapelli.
Yes.
7 yes, it's unanimous.
Thank you. With a unanimous vote of 7 yes, you have approved allowing staff members to use accumulated sick leave if they have some, or the other 1/3 that the act does not cover in their salary for childcare issues related to COVID-19. Thank you. Next, under policy review, we have the second and third readings of policy EBCFA face coverings. Is there a motion to approve policy EBCFA?
So moved, Wendy.
Motion made by Mrs. Rua,
Second, Carrie.
seconded by Mrs. O'Connor and Mrs. Reed. Questions, comments, discussion?
No one has any questions? Okay, then I'll go.
I'm sorry, Mrs. Rua?
I said I was surprised. I was waiting. No one had any questions, so I do. I had asked at the last meeting for a suggestion of an ad for the sentence where it says mask on school grounds, school transportation. I had asked if we can also add at school events. So I'd like to make that suggestion,
You'd
please.
like to amend the policy to also include at school events.
Correct.
Is there a second to Mrs. Rua's motion?
So moved. Second.
Seconded by Ms. O'Connor. Questions, discussions on the amendment?
Is that Mrs. O'Connor, Mrs. Reed?
So I thought that amendment was already in there when we voted on the first reading. It was not?
No, it wasn't. It was suggested, but we couldn't do anything at the first reading.
Okay.
We had mentioned, I believe, that this was the time when we were ready to vote to make any amendments. So she saved it for this particular meeting.
Can I ask for a question? It really applies to the whole motion, not just the amendment.
Right now, we're discussing the amendment. So
Right, you gotta stay on
Just
the.
the amendment? Okay. Then we'll discuss the motion. Okay.
Exactly. So is there any other discussion on the amendment? We have a motion and a second on the amendment to add all school events as well. Any other comments, questions, discussions on that amendment to the master
Can we
policy?
read the sentence with that all school events in it, please?
Go ahead. Do you have Mrs.
Yeah,
Hoffman?
a face covering that covers the nose and mouth must be worn by all individuals in schools, on school grounds, on school transportation, and at school events, even when social distancing is observed.
Okay, thank you.
You're welcome. Any other comments, questions, concerns about the amendment to the mask policy that's on the floor right now? Seeing none, Alexis, would you call the roll for the amendment?
Mrs. Reed,
Yes.
Mrs. O'Connor,
Yes.
Mrs. Rua,
Yes.
Mr. Minio,
Yes.
Miss Doobie,
Yes.
Mr. Bonavita,
Yes.
and Mayor Sapelli.
Yes.
7 yes, it's unanimous.
Thank you. With 7 yes, you have approved the amendment. Other questions?
I had also made a second, there were two suggestions at the last one that came for me to hold for this one. The second one was I had asked for language that said, exempt from this policy are students in grade 1 and below. I had asked for strongly encouraged. And so we have that document that was sent to us from Alexis with that language. Students in grade 1 and below are strongly encouraged to wear a mask. I'd like to further adjust that and ask the committee to entertain that students in grade 1 and below wear a mask, not just strongly encouraged, so that we have the mask policy from kindergarten through 12th grade.
So we have an amendment on the floor to add K and 1 as mandatory into that mix. Is there a second?
Second, Carrie.
Gary O'Connor seconded the motion. So motion made by Mrs. Rua, seconded by Ms. O'Connor. Questions, comments, discussions?
So this is Shelley. I would support the strongly encouraged, but I will not support the mandatory for the younger kids.
Other comments, questions, concerns?
I have a question, Carm.
Go ahead, Mr. Minio.
It's my understanding that regardless of age, a child does have to wear a face mask on the bus. Is that correct?
That's correct.
That is correct.
Any other comments, questions, concerns regarding this amendment?
Can we ask for, I've been getting numerous emails and again, committee to count from teachers who are suggesting that this will impact their ability to return to their classrooms and that they are asking us to seriously consider the kindergarten and first graders. With what Mr. Minio said, knowing that the kiddos are already wearing the mask on the bus and that this is one more ask of them to wear it into the classroom, not to consequence them if they take them off. We're not going to send a student home or consequence, we remind them. But can I ask Mrs. Hoffman, has there been any feedback from teachers, any kind of survey done, what the teachers want? Do we have information of where the teacher stance is on this at this time?
I have information from the AEA leadership that when they surveyed their whole unit, 92% of the teachers would like a K through 12 requirement. When you calculate that, again, this is from their leadership, 99% of elementary teachers would like a K through 12. And then when just asking kindergarten and first grade teachers, homeroom teachers, that percentage was 92.5% would like a K through 12 mask policy.
Thank you. Those are pretty high numbers.
Any other comments, questions prior to taking the vote?
Just to put it out there, I will agree to the strongly recommend, but I am not in support of mandating at the younger level.
Thank you, Mrs. Doobie. Any other comments, questions, concerns? Alexis, would you call the roll? A yes vote is that you are approving the amendment that would include kindergarten and first graders with the mandatory mask. A no would be you are opposed to that. Alexis?
Mrs. Reed,
No.
Mrs. O'Connor,
Yes.
Mrs. Rua,
Yes.
Mr. Minio,
Yes.
Miss Doobie,
No.
Mr. Bonavita,
Yes.
Mayor Sapelli.
Yes.
With 5 yes and 2 no, it passes.
Thank you. You have approved the amendment to add kindergarten and grade 1 to the mandatory mask policy. Any other comments, questions, concerns relating to the mask policy?
Yes, I have a question.
Mr.
Thank you. I asked the superintendent earlier by email, but I just want to clarify the answer if I could. Reading over the policy, when I saw it gave a list, and it said that certain items would require doctor's notes. I think the first, if I recall correctly, the first thing listed was that they have breathing problems. Now, is the way the policy is written, is that sufficient to require a doctor's note? That's my question, because I want to make sure that it does, so it doesn't turn into an issue, especially at the higher grades, of a situation where someone just doesn't want to wear a mask and might say, I have a breathing problem. I want to make sure that it requires a medical note from a doctor.
So let me read further, Mr. Bonavita, in the
Okay.
this policy. It says, in addition, masks or face coverings will not be required for anyone who has a medical, behavioral, or other challenges making it unsafe to wear a face mask or face covering. A written note from a physician is required for a requested exemption. Parents may not excuse their child from the face mask requirement by signing a waiver.
Okay, so that's generally that's basically saying is anyone that doesn't want to wear a mask for whatever reason, is not wearing a mask, has to have a doctor's note.
That's
so it
correct.
can be exempt. That's the way I'm understanding that. Okay, so I'm fine with that. What is and just to clarify for me, what would the repercussion be if someone came in and said, I'm in school, I'm sitting down, but I'm not wearing a mask? What would be the procedure on how to handle that?
So progressive discipline would be applied. We are currently adding COVID-related issues into our student handbook for students and parents to sign off on, and that would be included. So again, progressive discipline is a reminder, and what step at a time, each step getting a little more of a consequence.
See, that's where I have a problem, because if somebody comes in just one day and is carrying the virus and refuses to wear a mask, allowed to stay the entire day without a mask, they possibly could be infecting other people and they're asymptomatic. They may not show any symptoms, but still be asymptomatic and passing on the virus. So I'm concerned about that, allowing them to stay in school when they're refusing to wear a mask and they don't have a doctor's note.
Well,
That's my personal feeling.
And at different levels, like we're going to remove the student from the classroom environment if we're noticing they don't have medical documentation, they're not wearing the proper mask. Obviously, with younger children, we're going to maybe call home, maybe
I understand.
one of our masks. With older children, we'll do similar things, but we will remove them from the classroom environment if they don't have a mask and they don't have a documented reason.
So would they be put in a separate room or report to the medical unit, or how would they be handled?
It would probably be handled like they do other issues of that nature. They would have that child in the office area. The parent would be called and probably asked to come and pick them up if they were not in compliance and intentionally defying. But each one of these hypotheticals are tough to deal with because each situation is unique in and of itself. What type of student are we dealing with? What age of the student? What type of needs do they have? So all that enters into it that have to filter through. So it's kind of tough to give a specific answer in each case. Mm-hmm. However, they would isolate the child, the individual, the parent would be called, contacted, and then find out why this is going on. Maybe there's something more to it that we don't know. So it will be dealt with appropriately.
I like the isolation part. That makes me feel a little more comfortable. But isolated, with other people, it depends on where they're isolated. And I understand what you're saying about the different ages. I mean, if it's a first grader or pre-K versus somebody in 7th grade, I mean, there's a big difference, obviously, on how to handle it. But still, it could be a problem. If they're isolated, depends how. I'm just asking the superintendent to give more thought. I'm not saying I'm against the policy. I just ask that more thought be given as to how you're going to isolate them, where they actually would be. Because to put them in the principal's office in the waiting area, I'm not certain if that would be, totally effective as far as not passing on the virus to someone else. So I just ask more thought be given to that particular part of it. That's all at this point.
Other questions, comments, concerns?
Yes, this is Carrie. I know that within the mask policy, there is a bulleted item about mask breaks, and it's very vague. And I have a question for the administration, Sheila. Can you give some examples what that looks like? Because we do know that there are some areas that may be difficult to break within the classroom setting.
Yes, so all schools have been asked to designate an area for mask breaks that's not a classroom area for classrooms to use if they choose. We have tents ready to be rented at every building, and we anticipate that area being used frequently for mask breaks outside where, if possible. We also have several buildings that have exterior doors right outside their classroom or close by. We anticipate that teachers are going to use that space outside that's safe to take a mask break. We have mask breaks scheduled at every level at least 3 times a day. And then we've also said that at the teacher's discretion, they should add more. Obviously, again, more factors that go into how many mask breaks someone needs, their age, the temperature, the weather outside, the type of activity they might be doing, the type of class it is. So all of those have been discussed at a great deal, and administrators are being designated areas. Some might have like the cafeteria where we're not necessarily eating lunch anymore. Wider space can spread out. That might be an area for a mask break. So every school has a designated area that's not a classroom, and that could also be, like I said, the tent outside.
Thank you.
Mm-hmm.
Other comments, questions, discussion?
I have another one. Mr. Bonavita spoke to the non-compliant, non-mask wearers, but Mrs. Hoffman, if we have a legitimate reason, and there will be some students that cannot wear a mask, where do they sit in the classroom, in proximity to the other students, and are we distancing them more? What is the protocol for that?
So if we can, we will distance more, but we also have purchased plexiglass stations and partitions for students who we know can't wear masks. We have several on order, and we're looking at maybe possibly some more. We also have increased PPE for teachers in classrooms that have students that can't wear masks.
That's a very good answer. It's very detailed. I appreciate it. I can tell work's been done on that one. So thank you so much. Last question from me. I'm going to ask one more time about the ventilation, because if we are taking the masks off in the classrooms and you don't have a window, or if you have a student without a mask in the classroom and there's not a window, can we one more time, please, just because I'm still a little bit confused, I know our ventilation systems were maintained by our Agawam crew. Was there an outside inspection that happened? Yes or no?
Yes, and it involved a whole lot more than just the ventilation. That was one very small portion, which I didn't even know was included, but was. We got a draft of that report today, and we hope to have the final report soon. If not, I think we might have it. So we did do an outside independent study, survey is what it's called, on our ventilation, our filtration, our air quality, testing for different components in the air. And again, that draft has just been made available to us today. The initial preliminary results look like there are a few areas that were tested that need additional cleaning. But otherwise, most of the places that they tested had adequate levels of air quality and flow.
More than we ever wanted to learn about all this, right, Mrs. Hoffman? I appreciate your very thoughtful answers. I know you've been working really hard to get some of these answers. And like you said, from day one, patience was going to be a virtue. And here we go. We're getting some more answers over the time. So thank you very, very much.
At this point, Alexis, would you call the roll? We are now entertaining the we are going to vote on passing the math policy as amended. We have the two amendments that brought up and were voted on for including all events and K-1 students as well. So would you call the roll, Alexis, please?
Mrs. Reed,
No.
Mrs. O'Connor,
Yes.
Mrs. Rua,
Yes.
Mr. Minio,
Yes.
Ms. Doobie,
No.
Mr. Bonavita,
Yes.
and Mayor Sapelli.
Yes.
With 5 yes, 2 no, the motion passes.
Thank you. With 5 yes, 2 no, you have passed approved the policy EBCFA as amended. Thank you. With that, the chair will entertain a motion to adjourn.
So moved.
Motion made by Ms. O'Connor.
Mrs. Reed, wasn't it?
No, Ms.
Mr.
O'Connor.
Okay, sorry.
I need a second.
Second, Mrs. Doobie.
Ruby, Alexis, call the roll, please.
Bandit.
Mrs. Reed,
Yes.
Mrs. O'Connor,
Yes.
Mrs. Rua,
Yes.
Mr. Minio,
Yes.
Ms. Doobie,
Yes.
Mr. Bonavita,
Yes.
and Mayor Sapelli.
Yes.
7 yes.
Thank you. With 7 yes, we are now adjourned at 8:05. Thank you.
Sorry about the dog. Good night, everyone.
Good night.
Good night.